everyone, and thank you for joining me for this podcast. I'm Louise. I live in Israel, and I work at the Innovation Center of Denmark in Tel Aviv. I specialize in health, life science, and innovation. And on my podcast, Healthy Innovations, I explore new, hot ideas, inspirations within these fields. And today, I want to talk about FemTech. I already did a podcast on FemTech, but I think it's such an important topic. And we want to see the developments that have been made in recent years within FemTech and women's health continue, and I want to encourage that to take place. Just to recap, when I say FemTech, I'm referring to the development of new technologies for improving women's health. And women's health in this context refers to female-related medical conditions, but also general conditions where women have different symptoms and require different treatments or solutions. When I started exploring the topic of FemTech and women's health, I was really surprised to see how neglected the field of women's health has been for so many years. For example, the research funding in health, only 5% of that actually goes into research in women's health. And so last time I talked about what is women's health and FemTech and why has it been neglected for so many years. And today I want to look at what can we do to improve women's health, and also on the tech side, what technologies we need to develop for the benefit of women and our healthcare systems. And so Israel is one of the countries that is starting to look more into FemTech and women's health. And that's why it's interesting to explore what's going on here. And the Sheba hospital, which is the largest hospital in Israel and one of the largest hospitals in the Middle East, as well as one of the best hospitals in the world, decided recently to open a Women's Health Innovation Center. And so today I want to have a conversation with the director and brains behind this new innovation center, Dr. Avi Tzur. So thank you so much for joining me today to talk a little bit more about women's health and FemTech, because I think it's important that we continue to advance these fields. But before we dig into this, maybe you could say just a few words about yourself.
So before we talk about innovation, I'll tell you I'm Avi, married to Orit, father of 5 boys, no girls, between 13 to 2. I was trained as OBGYN at Sheba with additional fellowship at Stanford. And my time is split 100% clinical, then another 100% innovation.
Nice split. Yeah. Okay. And why has Sheba decided to open a women's innovation center, and why now?
So the truth is, Sheba is interested in healthcare innovation in general, and is not investing only in women's health. However, given the great neglect of women's health innovation on the one hand, and the great interest in innovation in the other hand, the opportunities in women's health are great. I think the greatest. I'm sure the greatest, but I think I was able to persuade my colleagues that they are in many ways greater than the opportunities in other fields that are very saturated.
Okay, yeah. And why do you think that it has taken us so long to focus on women's health? Why have we neglected that for so long?
So there are various reasons. I must say I remember my first startup in women's health. I started it at 2013.
Yeah.
Back then it was a mechanical device for preventing preterm birth. Back then I was surprised to discover that health VCs, first, they don't want risk, right? They call them venture capital, but they are really risk averse. And pregnancy is involved with a lot of risk. So anything to do with pregnancy is less attractive for investors.
Although you would think there was a big market, because
right,
you
think.
Yeah.
So first, then the second thing is that's the first reason.
Mm-hmm.
The second reason is understanding the major unmet needs. So I think that given that most of entrepreneurs in the history were male and most of the investors were male, I think they had less understanding of women's health needs, both the major clinical needs and also less clinical needs that are also part of FemTech.
Okay, yeah. And what kind of solutions do we then now see being developed in FemTech? What are the focus areas?
So there are a few types of solutions. I tell you, we as a Women's Health Innovation Center are focused on clinical solutions.
Okay.
We care about solutions that can change the clinical management. Me in person, my clinical work is in maternal fetal medicine, so I care most about solutions improving the pregnancy continuum journey, starting with fertility, through the pregnancy itself, prediction, precision, prevention of pregnancy complications, into the postpartum period, into leveraging pregnancy to predicting long-term women's health and general health complications. We're also very interested in complications related to endometriosis, which affects 1 in 10 women. We're also interested in gyn-onc difficulties, and we're also very interested beyond reproductive health. So one of the things we're looking to very much this year is not only women's health as reproductive health, but also thinking of autoimmunity, of cardiac disease and other conditions, the way they affect women.
Yeah, the more general conditions. Yeah, okay. And what are the biggest forces driving this change? Like, who is driving it? Is it the research, the innovation, the investments? Is it the government pushing this forward?
This is a good question. I tell you what changed. The need didn't change. The need was there, was always there.
Yeah.
The things that change is, I think, is the women themselves, much more involved. I think that's what I see the difference between. I don't know, the history of innovation. I know the last 10 years. So I can say that I see much more involvement in women for women, in women as entrepreneurs, in women as investors, in women as advocates of innovation in the field. So that's one great change. And I think the other great change is, and again, as our focus is in clinical innovation, I think that, for example, the European system, for sure, and in many ways also the American system, as it's changing to value-based care, if you want value, you need innovation. And in the case of women's health, the system is paying a lot for the neglect. So, a woman developing preeclampsia costs the system, you say they care, they don't care, I don't know, but they pay for it. They pay for the pregnancy, they pay for the antepartum high-risk admission, they pay for the neonate costs, and they understand that investing in the field could reduce the costs.
Because it's been a challenge before to also show that to the system, because the system often wanted to be sure how much they could save by making investments, and that saving costs money. So I guess that's kind of changing that way of looking also at women's health, that it's actually worth investing in it without knowing the exact amount that we can save.
Definitely, I think the numbers are very clear these days, at least related to fertility, pregnancy, and the long-term complications. The numbers are becoming more and more clear.
Okay, yeah. And then what do you see are the challenges that we're still facing in advancing this field? Because I know both in Denmark and Israel, it's a field that more are starting to look at, but we still see that it's very difficult, especially to get the investments. So what are you telling now the investors that have been so maybe risk adverse from this area? How are you going to convince them and others to focus on this area now?
So I'll tell you, the hurdles are still great. I start with regulation.
Yeah.
So I'm not talking about regulation of the innovation itself. I'm talking about regulations of implementing the solutions. So let's say one of my greatest passions is maternal fetal telemedicine. That's remote care for pregnant women. And I must say that both the regulation and the reimbursement are very much lagging behind the opportunities in all parts of the world. Yeah. Israel, Europe, United States. Actually, in this specific aspect, our situation in Israel is a bit more favorite. But there's currently, I see, hard to get CPT codes, that's reimbursement codes for treating pregnant women remotely. And I think of it, let's say, in the American system. So it doesn't matter if a pregnant woman, if she's a CEO of a company or a Medicaid patient with 5 children that needs to treat them and doesn't have money to pay someone else. Yeah. If she can't receive remote care, it's actually creating greater cost for the system in the long run. Yeah. And I don't currently see neither the regulation nor the reimbursement adjusting to the opportunity, the great opportunities being created to treat women remotely. So two things is clearly, it's one thing, it's policy that affects both the regulation and the reimbursement. I think the technology, so for many years, because there wasn't the funding incentive and there wasn't the policy incentive, the technology was lagging behind. Currently, it seems to me that technology stopped lagging behind. There's more and more technologies. They are not the hurdle anymore. And regarding the workforce, actually, I don't know what's going to happen in the next 10 years, but I think this is, if you look in the history, in the past 100 years, there was no such time that so many people, men and women, are interested in innovation in women's health and FemTech. And I'll give you what's my strongest example. A few weeks ago, a company developing a solution for selecting semen for IVF reached out to me. They want my support. So I asked them, why are you reaching out to me? They told me because it's FemTech. So I said, okay, if a solution for semen brands itself as FemTech, it means times have changed.
Right. Yeah, that's true.
That's true.
Yeah. Okay, so then what would you be your kind of number one advice then of what do we need to do now then to change these challenges? Who do we need to give a push?
So I'll tell you, the greatest economy driving innovation is the United States. For various reasons. One of the reasons, if you get FDA approval, you get all the American market. If you get I don't know what's the regulation in Denmark, but if you get
the EU regulation.
Yes, the EU regulation, if you get a CE mark, it's not enough. You need additional approvals, state-based approvals, and that's why it's very hard to enter the European market. And that's why still health tech companies usually start with the American market. And to your question, how to change the American system, that's bigger than me.
Yeah, exactly. Okay, and Jen, just to focus on a different aspect, you actually also touched on it before when you were talking, is we do see also FemTech bringing out a lot of female entrepreneurs that we haven't seen in other fields where they could also be developing new solutions. So how can we use this to encourage more female entrepreneurs? And are you doing anything at Sheba to kind of try and bring in the female entrepreneur? Even finding solution for female conditions will help bring out females more into the workforce and them staying and gaining more higher positions, because we also have an issue there for women that at some points in their life they're kind of out because of female conditions. But what are you guys doing to try and encourage more female entrepreneurs? Because we also need them to kind of change all of this.
So I'll tell you, definitely I agree with the need for more female entrepreneurs, not only for women's health innovation, right? More female entrepreneurs would in general make entrepreneurship better. I can tell you my personal ecosystem. My sister Michal Tzur, I don't know if you know her, she's one of the Israeli not only health tech, high tech leaders for many years. So my wife, Orit, is an entrepreneur after a few exits. So I come from an environment of women entrepreneurs.
Yeah, but that's rare.
I tell you the truth, I believe entrepreneurship, it's very hard for a country or a hospital to make decisions. I can say that in our most recent and one of our most promising startups, Sheba, that's developing maternal fetal precision medicine, we picked Sharon Handelman Gottlieb as CEO, and I can see every day, including today, the merits of women entrepreneurship.
Yeah, good. So just to kind of round this off, I wanted to take a look into the future as well. And to say, if you're looking 10, 15 years ahead, what do you think would be some of the most fundamental examples of how we've been able to change the treatment of women and the attention to women's health?
So as I told you, I split my time between the clinical work and innovation, and sometimes it's very striking for me the differences when you move between the worlds.
Yeah.
I don't know if you know this, the McCoy in Star Trek, at some time he sees a patient shouting for help. Then he comes to her and asks her, what's the matter? She says, I'm waiting for dialysis. He says, what? Dialysis?
Yeah.
Take a pill.
Yeah.
And in many ways, in the world of innovation, we're already dreaming about women's healthcare being totally different. Pregnancy being managed at home, maternal fetal precision medicine, endometriosis being treated with much less surgery and much more biology. I believe all these things will be here. I believe that many of them much before 10, 15 years. Actually, I think in 5 years from today, we'll see at least half of the pregnancy being treated remotely, especially the high-risk pregnancy. A big chunk of it will be treated at home. And I think this is going to be a very big change, not only clinical change, it's going to be a big social change.
Absolutely, yeah, exactly. Great, so thank you very much for joining me today.
It was my pleasure.
To have a talk about how we try to advance this very important field. And I also wanted to thank all of you for listening. And if any of you have topics within health, life science, health tech that you would like me to explore further, or people you think that I should have a chat with, then please reach out. I'll be very happy for any suggestions. And I will see you next time.